Hi listeners, Jason here. We are excited to finally announce registrations for the biggest psych health and safety community event ever. The inaugural The Psych Health and Safety Conference will be held at the Sofitel Wentworth, Sydney, June 19 to 20, 2024 and offer concurrent virtual attendance. It'll feature live podcast recordings with OG researchers including Christina Maslach and Michael Leiter of Burnout fame, Psych Health and Safety USA podcast host I. David Daniels, Australian super experts including the likes of David Burrows, a special 10-year anniversary integrated approaches to workplace mental health panel with authors Tony Lamontagna, Angela Martin and Kat Page, hand-picked case studies from organisations doing it well, and a very special interview with plaintiff Zagi Kozarov by Catherine Dunlop on that High Court case which we previously covered on the podcast. This event will sell out. Get in quick to secure tickets at early bird prices for the 2-day conference, pre-conference masterclasses, and the VIP dinner. The first 200 in-person registrations also get a copy of her latest book, The Burnout Challenge, signed by Christina Maslach herself. Find out more and register at www.psychhealthandsafetyconference.com. Now, on to this episode.
From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hello and welcome to the Psych Health and Safety Podcast. My name is Peter Kelly and I am one of the co-hosts with Kate Field. How are you, Kate?
I'm very well, thank you. It looks like it's a lot sunnier where you are than where I am.
Yes, yeah. For those that are watching this, you'll notice that myself and the guest are in the same hotel, different rooms, obviously. So we're in Malaga. No, we're not. Sorry, we're in Granada at the European Academy for Occupational Health Psychology, which is a wonderful association that we've been involved with. And Kate, you're in a summer dress. Am I missing out?
No, I'm desperately being brave and summer is here. I will battle through, but I've got a jumper behind me which will probably go on again shortly because it's cold and miserable in the UK.
Okay. Well, let me take the opportunity for our guests to introduce themselves. This is going to be a fun one. This is kind of like a busman's holiday for us three. I'm sure my guest will introduce herself and then you'll understand why it's a busman's holiday. Over to you.
Okay, so I'm delighted to be here with you and thank you for the invitation, Peter and Kate. So my name is Stavroula Leka. I'm a professor of organizations work in health at Lancaster University. And I'm also the president of the European Academy of Occupational Health Psychology that Peter mentioned a couple of minutes ago. We are a UK charity that promotes the discipline of occupational health psychology. So anything that has to do with how we create healthy workplaces, reduce psychosocial risks at work, and prevent work-related stress and related problems. So we are having our 25th anniversary this year, and we are hosting our 16th international conference in Granada, Spain, which is actually starting in about half an hour with some pre-conference workshops. So very tight program, but I'm delighted to be here with you to talk about this important area.
Yes, thank you very much. And you failed to mention that you were one of the conveners for ISO 45003, did you not?
Yes, I did. So yes, as Pete said, we together with Canadian colleagues. So I was the co-chair, co-convenor of the working group that developed ISO 45003. That came obviously after many years of being involved in this area. We originally developed with BSI the first standard, national standard in this area that was launched back in 2011. And our Canadian colleagues did the same in 2013. And then we thought, well, will join forces and put forward the proposal of developing an international standard in this important area. And then we had to wait for a bit until the 45,001 on health and safety was finalized, and we followed up and worked to develop 45,003.
For those who are not familiar, PAS 1010 was the UK standard. We're both geeking out here. All three of us are geeking out. I guess ISO was 45,003 was a standard waiting to happen. We just had to get the right level of commitment, did we? What's your reflections on it?
You're right, it was waiting to happen, obviously, because the area of, the title is Psychological Health and Safety at Work, Management of Psychosocial Risks. So this area obviously has become extremely important over the past decades. And so there was engagement among different policymakers, both at in various countries, but also at the international level, because we needed more specific guidelines for organizations. And standardization is one way to achieve engagement by our employers in this area and promote good practices. We were delighted actually that through this process there was quite a high level of agreement among countries, even countries where there is, we acknowledge that there is a lot of expertise, and others where there is not. They all came together, and it was a very, very interesting experience to develop that standard. And I believe in the end we got a good outcome. Of course, the fact helped that in the UK and then in Canada, and just before, as we engaged in the process in Australia, there were examples of national level standards in 3 countries. So yes, it was interesting because we had rich experiences in some parts of the world, while in other parts of the world, as is usually the case, this is, there is less expertise, less experience with such issues. So it was very fruitful to share such experiences and to debate, to finalize the text of the standards that, of course, reflects good practice and the knowledge that exists across the world in this area.
Lovely. Thank you for giving that context. So one of the questions that sort of organisations that I engage with around 45,003, and there has been a huge amount of interest because it's such a great standard, is why isn't it a requirement standard? And is there any plans to make it a requirement standard so that organisations can, it's the same level as 45,001, which means it's easier to go through an accredited certification process?
Yes, and that is a good question, Kate. And I think we couldn't reach that level of agreement at that point in time, at least, because this is supposed to be a standard that supports the implementation of 45,001 as concerns the management of psychosocial risks at work. So, yes, I think that the broad feeling at that point in time was that we don't need another requirement standard because we have 45,001. Having said that, there were voices in various countries that said, well, we think that actually a requirement standard might have been more useful because it would make clearer the obligations of employers in this area and would send a stronger message. So there were these reflections. Now, you probably, I think the viewers will know that standards are updated every few years, so we're not there yet. I think they're starting the process for the update revision, if necessary, of 45,001, and we'll follow after that. At that point in time, we will be discussing that, and at the moment, I don't think there have been any discussions around the need to turn into a requirement standard, but in a few years' time, maybe we'll see something else, especially as the policy context is developing, which means that there are now legal requirements in many countries around the world in this area.
Yeah, I think that was my reflection in that actually a lot of countries realise that although existing health and safety legislation technically might cover psychosocial, in reality it's not doing an effective job. So a number of countries are pulling it out as a kind of a separate set of legislation. And I think I'm seeing the same from a standards implementation point of view. 45001 is probably one of the fastest growing standards being used in the world ever. But organizations aren't using that to address psychosocial risks, and the uptake of 45003 is still, I would say, quite slow overall. So I think there's definitely an opportunity for us to help the world on their journey.
Yes, and quite rightly. So I said standardization is only one way to engage good practice, but we see exactly the same situation when it comes to regulations, right? So, for example, in Europe, out of the 27 member states, there are now 16 that have specific legislation that move beyond the baseline of the European law, have specific legislation around psychosocial risks. And of course in other countries like Australia, for example, in Canada, in some of the provinces, and we see in Japan also they have relevant legislation. So we see movement in various countries in this area, and that is because of that exactly, that the general text of law and the baseline health and safety laws maybe is not updated, has not been updated in recent years to include specifically the term psychosocial risk or workplace stress. There are countries that have done it and they have gone beyond, let's say, baseline health and safety legislation, and others who have not, who stick to the general text and they provide guidelines or standards or other softer forms of policy, like let's say sectoral agreements, social partner agreements. And yes, there is a discussion actually going on in Europe at the moment about the possible introduction of more specific regulation in this area, maybe through a directive on psychosocial risks at work, to reflect this discussion and debate across the member states of the EU.
Bring it on.
Bring it on. Well, I mean, it is. Yeah, go on, Pete.
We've done this for years, Stavroula. We've been mates for 15 years, 20 years nearly. And I remember when you first were doing your PhD, the last year of your PhD, and now you're a professor. But you've really pushed through that time with, particularly in the UK, and we'll talk about the UK context of the UK Psych Health and Safety podcast, about pushing that agenda. You were a very strong critic and an equally positive praiser when we were developing the management standards. But where's your commitment come from? Why have you invested your entire career into this area?
Oh yeah, why? Yes, and specifically in policy. Yeah. So well, I mean, I originally come from Greece. So when ages ago now, in 1996, I moved to the UK to do my postgraduate studies, and I've met Pete shortly after that, I think. Greece obviously had joined the European Union, and there were a lot of debates even from back then about how EU legislation is transposed in different countries and the experiences that they have with this transposition. And so my PhD actually back then looked at that. So in the UK, how do we take the European laws and transpose them? What is the limit of that regulation, other forms of policy? And I did the same in Greece and did a comparative analysis. And what became very clear is that, of course, the UK was far more advanced in terms of commitment to this area. However, there was no clear agreement among the stakeholders, so employers, trade unions, on the need of more specific even regulation in the area of psychosocial risk and work-related stress, which is why, of course, we went for the management standards approach, which had its benefits as well. It was a useful approach because it was based on data that had been collected over a long period of time. There was a lot of good experiences, and there were the very useful tools that were developed that went alongside it. And still, despite the UK not being part now of the European Union, the management standards approach, of course, has been adapted and used in other European countries. So, for example, apart from Ireland, of course, that has a work positive tool that use the management standards. Countries like Italy, like Estonia, Lithuania are using the management standards approach, and they have adapted their own legislation to refer back to the management standards approach, which is very interesting. So in the UK, we stayed with sort of softer approach, but in other countries, that approach was taken and incorporated into law, which is very interesting. So I think that they're doing evaluation studies, and at the end of this month there is a meeting in Brussels to bring these countries together that have developed different approaches and learn from their experiences. So it will be interesting to see what the outcome of those debates will be. So the engagement among stakeholders, yes, you hear the same kind of arguments, of course, that we cannot burden our enterprises with more and more law, and I think that's fair enough. But what we need to remember is that when regulation is developed, impact assessments of that regulation are being conducted in advance to see what would it mean if it was developed and would the situation be if we stay with the status quo. And we saw a very interesting such impact assessment being done in Australia recently, before they decided to introduce more specific regulation. And it was actually the first time that I saw the multitude of data that exists out there being used properly. So what would happen if we actually did not have more specific regulation? Well, we would continue to see so many people being off sick. And we know in the UK we have the highest number of people being off sick ever. We will continue to see problems with productivity, sustainability of enterprises, etc., etc. That even, of course, have an impact on the economy. So they did use the data very well, and I have to say that doesn't happen always in terms when we look at impact assessments. Hopefully we will engage in a better debate going forward, and convince all stakeholders that it's worth looking at introducing more specific, whether it's guidelines, what is the standards that's a requirement or regulation in this area.
I think it is interesting, and I think, looking at the UK approach, listeners will know that I'm a big fan of the management standards, but I don't think they've had the impact in the UK that we would have wanted them to have. And I do feel that if we really want to raise the bar, then we need to at least tweak the legislation, so it's much more explicit. But I also wonder whether we might see some different industry regulators perhaps approach it as well. We had Mark Atherton on recently, and they're pushing for the aviation industry to address this, and obviously that's regulated separately. Do you see any kind of industry specific regulators talking about this subject and engaging with it at all?
Not to the yes, I mean, okay, there are. Not to the extent that I would say that there is commitment to go for a broader regulatory approach. Yes, there are certain sectors that are more committed, let's say, to this area. But I wouldn't say that they so far I have seen the commitment I would have liked to see in terms of developing more specific regulation. Having said that, even at European level, the health sector, of course, has its own directive that it regulates the sector, and they include in there the term psychosocial risk and they talk about management, prevention, psychosocial risk. So it is possible. And we know, of course, that sectors such as health or education or, of course, indeed aviation are having a strong interest in this area.
I think that's that. Yeah, I think it's interesting. It's going to be curious to see how the legislative framework develops over time.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
I suppose, standards go through a review process, and you said we've got a little bit before 45,003 comes through. Were there any key areas that you felt didn't get included because they were particularly contentious, and you'd like to see kind of included in the next revision?
Well, I think there was as I said before, there was a lot of healthy debate, and even to get to agree on certain terms that were included in the standard, we went back and forth various iterations a few times.
Stavroula, is that what it was? Healthy debate. I recall it being heated and health and equally. Yeah, so it was good. It was good, but yeah, I'm glad it's healthy debate. That's how I'll reference it in the future.
Yeah. Well, at least I try to think about it this way. Being the convener, I have to thank Pete, of course, because twice he stopped me from quitting. Thank you. I keep telling you this. So it was healthy to a certain extent. And why did I want to? Because I thought, as an expert, that there are certain debates that do not matter so much and others that do. And the reason we developed the standard was to promote good practice and awareness and engagement, and whether one particular word differs a little bit. I'll give you an example. Some countries wanted the word psychological health, others wanted mental health. As simple as that, right? And there was hours of debating whether we should go with mental health or psychological health. In the end, we went with psychological health, but we include the term mental health in the text. So do you see what I mean? It was just sometimes you felt like we are engaged in these ongoing debates forever, when actually we should be geared more towards what enterprises should know and the key points and things that they should do. So while I think the standard is quite comprehensive, there are certain, of course, limitations to the way you write standards, as is understandable. The first thing, of course, that we'll go back and see and introduce in more detail is the inclusion of certain psychosocial risks that arise from the changing employment contracts and changing nature of work, the impacts of technology, etc., which we refer to in the text of the standard, but I think we need to revisit the text there to make it a little bit clearer. And in fact, there has been a big review now, that many reviews, but a comprehensive review that will be published, I think, next month, that specifies different examples that should be considered of psychosocial risks as they relate to digitalization, for example, robotization, automation, and new types of employment contracts. So that, I think, is one area where we will need to revisit the text. If we had freedom, let's say, and I don't know how much freedom will be there in the future either, it would be nice, I think, to provide some clearer examples, perhaps in the annexes, that employers could look at. How do they more specifically go about to conduct a risk assessment? How would the policy around psychosocial risk would look like, or if you like harassment, etc. Because in some countries it is covered actually in the same area, and it is in the standard. What are some examples of good practices? And in fact, now we have guidance, a lot of guidance around interventions. So we have some of them in the standard, but perhaps we can produce some more. If it is a smaller organization, for example, could we come up with some kind of checklist that will make it easier for them to engage in this area? So I think in terms of tools, the standard can be turned into something much more usable if we have these kinds of examples included.
I look forward to the debate.
Oh, yes. Oh, yes, me too. Yes.
One of the joys of standards making. Why do you think, I mean, in the UK, we've got some of the strongest academics working in this field, but we still don't have the same level of influence, perhaps, that we should. Why do you think that is? Because you could look across, there are a number of people in the UK working specifically around psych health and safety. How do you think we've bridged that gap?
And to be honest, a lot of it has to do with other influences, I would say. Even political influences. And I think the UK was, of course, it still is, let's face it, recognized as one of the pioneer countries in this area. Sure, other countries have now moved ahead in terms of putting in place, as I said, more specific requirements. The Nordic countries have for many years been very active in this area, not only them anymore. But I think there needs to be also in certain levels certain political will, let's say, to address issues that are important. So I think when you sometimes engage with policymakers and they still refer to high-risk sectors as those sectors that are only affected by accidents, I think this is, for me, for example, is an outdated way to see things, and you're missing out and a long chunk of the data that is out there that tell us that people's main struggles are in relation to their mental health at work. The way we define even concepts like high-risk sectors and how the use of these terms enters the policy debate will need to be looked at. So I think, yes, there is a lot of good knowledge and experiences and expertise in the UK, and still, of course, all of us are working with all across the world, and I think this is still recognized. But sometimes to make things happen, you need another level of broader social and political debate to move things ahead.
What's interesting is when we started out simply to provide a risk assessment, not an actual management system. I think you've heard me say before that had we launched the management standards when we did, we would have, in a perfect world, have included it as a management system, and we would have looked at frequency, duration, and severity in the tool that we've had. And now others have done that since. But it is it's fascinating that even now we're still having to debate with policymakers about what we mean by psych health and safety. And I mean that across the globe, not just exclusively. When we had conversations early on with the Australians about their legislation, it was like, well, you can do this because we've shown you can regulate. We've shown that regulations can work, and they do have an impact when they're proportional and put in place. And now we find ourselves watching from afar in a longing look of like, yeah, okay, the legislation could work here, and I'm going back to Australia shortly, and I'm looking forward to talking to colleagues down there about how it's been taken up. Do you think, in the big European question, um, is there a will? Is there a way towards a directive? Because let's take ourselves right back to 2012 and 2010 when we decided to do either the Premier EF work, and then 2015 there was the psychosocial year with the EU OSHA campaigns. You've got lots of trade union involvement in the European Union at the moment, and you have member states that are okay with the concept, all sort of lining up. So I'll let you give your insights, Stavroula.
Yeah. So I think you're quite right, Pete, and I think I mean I joke sometimes, and I say, well, I sometimes reflect on my career, and I think, oh my God, every 3 years or so, I write yet another piece of guidance on this, yet another major report on this, and in an essence, you don't actually add a lot new information in there. Yes, you update the knowledge, but the key messages are the same and have been the same for some time. So you're quite right there. I think yes, the broad answer is yes, that we're moving closer to regulation. I was in Brussels in January, and for the first time, the Vice President of the EU and both the Commissioners for Health and Employment did say openly we need law. Now, we have to take it with a pinch of salt because, of course, as you know, it's the European elections this week, so they knew they're all up to be re-elected. So whether we'll have the same faces there or not, we don't know. But in the room, there was some more enthusiasm around the political will, and that is because we have, as I said, seen a lot of countries move towards that direction in Europe. Belgium initiated this debate that together with other countries has quite a detailed framework, legal framework in this area. They have a lot of tools and a lot of good experiences. So Belgium still has the presidency of the Council of Europe for a few more days, and which is why we are going back to Brussels at the end of the month to continue this debate. So I think because now we have 16 countries in the EU that have specific legislation, because we have analyzed data, so there are employer and employee surveys in Europe that we have analyzed to show how those countries that have legislation fare in comparison to others. And we have seen that actually there is a positive effect, but our employers need still more support around the area of interventions, that we all know that. And we have seen that in those countries, in fact, that there are legal requirements, interventions appear to be linked to less work-related stress, only in those countries that have regulations. So it's very interesting that we now are able to show that even through using large-scale data, which, you know, one can say do not capture, of course, the nuances in enterprise, and they don't. But still, we are able to show that picture. And so we have used it as experts, and other stakeholders, like, as Peter said, the trade unions have used it to campaign very strongly for the need for new regulation in this area. But I think also through the experience of the pandemic, of the recent pandemic, the COVID-19 pandemic, that where mental health came to the forefront, and employers in a way were forced to pay more attention. And it became very personal to them as well. So I think there's now more awareness and more will to discuss these issues, and employers are actually quite open to discussing these issues. Any, of course, development of regulation takes years. It's a very long process. But even if we went away, let's say, at the end of this year and said, well, we engaged in all these debates, and now we can clearly say there is agreement that, yes, we'll need regulation, and we will move forward and see what's the best way to put it in place, would be a positive move in the right direction. And I will be extremely happy to see it happen after so many years being involved in this area.
And if you were looking for a management system to compare yourself against in that regulation, ISO 45003 would give you those elements, would it not?
45,003 would, of course. There are, of course, nuances because I have been analyzing regulation in various countries. There are nuances and differences a little bit. Also, to a certain extent, reflecting simply the different languages in the EU. So the terms are not translating as easily from one country to the other. But of course, as I said, 45,003 is bringing together all knowledge that exists and expertise that exists in this area. So it is good practice anyway. If we go towards legislation, we'll still engage on a very long debate around terminology and how exactly we present and reflect the knowledge in that piece of law. But I will tell you that there are stakeholders that already have started to look at what a directive would look like. So for me, I think the next thing that we will see is probably some draft text of a directive in this area that they will start to use and debate around and see how perhaps we can reach that goal of having more specific regulation.
I have so I was just thinking about the legislation question, and I think there is a need to have very specific legislation, but there is other legislation that is having kind of a ripple effect to a certain extent. So things like the Social Value Act in the UK, interestingly, is increasing the awareness around 45,003. In the EU, we've got CSRD and actually the new due diligence directive. And the question I had was looking at both of those, they make reference to organisations need to ensure that they are either sort of following or down their supply chain the ILO fundamental rights. And of course, health and safety has been added as a fundamental right, but it doesn't specify psychological health and safety. What do you have a sense about how the ILO positions psychological health and safety? Do they see it as part of health and safety? So when organisations are thinking about, how they can show that they're, I'll use the phrase conforming, or looking at those fundamental rights, should they be including psychological health and safety? Is that the ILO's vision?
Yes, I think with the ILO, you're right. I mean, first of all, we have this now inclusion, as you said, the right to a healthy work environment has been enshrined as a fundamental right at work, which means that every country that is a member state of the ILO, which includes, of course, all the EU member states and the UK, should adhere to this principle, no matter whether they have ratified relevant conventions or not. So that is the starting point, and I don't think many people are aware of that. So it's not only a matter of you ratifying the health and safety conventions or not, or other relevant conventions. As a member country state of the ILO, you have to adhere to that basic fundamental right and principle. I would say that the ILO does include it, and that was made very clear through Convention 190 on harassment and violence at work, that includes very specific text on psychosocial risk assessment and management. So if you go into the text of that convention, it does give you detailed guidance around these issues. And in fact, it has impacted the revision of legal text in many countries. Also in Greece, where I come from, finally we have a new legislation after the ratification of that convention to refer directly to psychosocial risks and their management. So yes, I think there is a clear message there that the fundamental rights include psychological health and safety as well. It wasn't always very clear, but I think now it has been made clear through the new convention.
Great, thank you. Very, very interesting. Well, it's like a pincer movement. We'll keep working.
Exactly. I think that you will see that at the ILO now, because again, I said this organization is quite political. So I think that over the next years, you will see more engagement in this area. And in fact, the European Academy of Occupational Health Psychology at the moment is discussing with the ILO a high-level event next year in in Geneva around this area. So, well, they said they agree to it and they're very happy to host it, but we will, of course, keep everybody involved and updated so that you can
send me an invite.
Of course, absolutely.
Thank you. I love Geneva, just for the record. We're coming towards the end, and this is really the last question. What would be the one thing you would want to tell our audience about psych health and safety? And additionally, what else do you think you would have done if you'd never fallen in love with this area?
Oh, well, what else would I have done? I'm not sure. Because I love doing so many things. So, when you reach a certain age, point in your life and a certain age, you're thinking, maybe I should have done something completely different, like engage in the arts or architecture, something like that. But that's another. What is the one thing? The one thing is that employers should not be afraid. Nobody should be afraid of this area. Because if you care of your employees and you care about your business cannot exist without the consideration of psychosocial risks and how to promote psychological health and safety at work, simply speaking. And it goes back, it's as old as work itself. Sometimes I know we call it modern risk or emerging risk, but actually they're not. And if we think about what work means for us as individuals and how it fulfills certain needs that we have as humans, let's say, and as social beings, it's something that needs to be taken care of. And we cannot have successful organizations, and in fact, we cannot have sustainable societies without looking at these issues. So I think we need to demystify this area. We need to talk about it with in simpler terms and remove the stigma that is associated with it even now, and that is I think quite sad to see in certain cases. So I think that is the one message: demystify the area, and it's simply doing the right thing. And even if you're only coming from another perspective, the perspective of, let's say, the business case of doing the right thing, that is there too. We now have evidence for that as well. So it is in everybody's interest not to ignore this area.
Absolutely. And thank you very much for taking the time out. I look forward to meeting you for a sangria by the pool later. For those of us that are, although we are 30 minutes out from hundreds of people turning up for registration. I just wanted to thank you again, and for those of our listeners, we look forward to hope you can listen to this on the various different channels, the YouTube channel, the podcast, wherever you listen. We look forward to keeping in contact, and we will be on again, will we not, Kate, shortly, with another great guest.
We will indeed. In the meantime, good luck with the conference, and enjoy your sangria later.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.